And today we're going to be talking about the trauma and survival of breast cancer with none other than Kamala McWhinney, who's a psychologist and also a breast cancer survivor. Kamala, good morning. She's joining us via Zoom. Yeah, so we're just getting the connections together.
Hi, good morning, everyone.
There you
she
are.
is.
Good morning to you. Glad to have you.
It's good to be here. How y'all doing?
Oh, we're good, Kamala. We're good. We're giving thanks.
Yeah.
Excellent.
All right, now, Kamala, the trauma and survival of breast cancer. First of all, whether it be from your own experience or experiences, helping others, what would you say is like, what is the mindset like after diagnosis, and what is the impact like on that patient?
So the mindset, trust me, it can vary. I mean, the most general thing that hits most of us when we hear the words breast cancer in relation to us is shock and denial. And then, of course, just thinking ahead of the difficulty of dealing with this. And of course, all the uncertainty that goes with it, especially before you have all of the figures and all the stats and all the details, it can be really, really difficult. And then let's remember that in Jamaica, especially, cancer used to be like a death sentence. Like once we heard cancer, one time gone, we used to think, okay, this is it. That's no longer the case, but a lot of people still, it's human to still kind of have that fear about whether or not we're going to have a good chance and a good prognosis of surviving this thing.
And that takes me to the next problem with them. And I would say problem, and a next situation that happens with the mindset, depression. That definitely plays a part. Are there any stats or facts as it relates to the rates of depression in breast cancer patients in Jamaica or in general?
So I don't have any specifically related to Jamaican women who are going through breast cancer, but I know that globally there have been several studies which compare research in different countries, and we see like a 32% prevalence rate of depression in women who are, living with or going through treatment for breast cancer. And then some of the studies do show that for younger women who are going through depression, the rate, the prevalence of depression tends to be higher. And there's so many reasons why that makes sense.
All right, understood. Now, let's take us through the steps as it relates to coping with diagnosis. And are there any coping mechanisms that can be taken by breast cancer patients?
Oh, absolutely. So one of the first things I like to say is, look here, it's important for us to connect with ourselves, especially emotionally. And I know for many of us, it's not something that we probably prioritize doing, but especially when you're going through something that's life-threatening. And this is applicable to not just breast cancer, but just in general, right? It's important to start or continue that practice of checking in with ourselves and like being better able to name our emotions. So for me, I had to come to the reality that, look here, I'm very angry about this. I'm vexed with God too, right? And I had to be better able to process my emotions as I went along and be able to talk about those with somebody. So I would say the first coping mechanism I would recommend is just that emotional connection with yourself, and being able to work through that with somebody. And that brings me to like my second session for coping, which is support. And that is a huge piece. We can't state it enough. How much having people around you, especially people who are like reminding you that, listen, I've got your back. I'm not going anywhere. I'm with you. That's crucial as well. And the next thing I would say as it relates to coping with breast cancer is tapping into some source of joy, because there are enough things on the breast cancer journey, the diagnosis and the treatment pieces of it, that can just make you feel like, look here, this not nice. I don't enjoy this. This is difficult. And maybe even make you feel as though you will never have, that sense of fulfillment again. So it's important to tap into something. I call it filling up your joy jar, whatever it is that makes you feel alive. If you're a creative person, tap into those things, because having a diagnosis is not the end necessarily of life. So when you're going through the treatment, still remember to live. And as I like to say, live fully as you can.
All right. A lot of that focused on the person going through this process, and you touched briefly on the support system, those around you. Could you speak to us, those who are supporting an individual going through this? What would you like to see in our attitude, in our behavior, how our sensitivity to women going through this process?
I love that question. So the first thing I will say is it's important to remember that it's not we going through as a support person, it's them. Because too often people, well-meaning as they are, tend to make the breast cancer diagnosis about them. Lord of mercy, me can't deal with this. Like I'm stressing out. It's important to remember that this right now is a journey that the other person is going through, and we have to be careful not to put our stuff on them. So, for example, I remember when I was diagnosed, one of my friends, who's also a psychologist, called her mother and she was bawling. Now, I'm grateful that she never called me with the tears because I already had enough tears of my own, right? So she had enough self-awareness to know that, yes, it's difficult for me as somebody who loves and cares for Kamala, but right now, I shouldn't be putting the burden of my emotions on her as well. And her mother was like, "Well, yeah, put tears on the woman, pitney for make she go through, just hold her up, right?" So remembering that it's not you and putting the person in right perspective. The second thing I would say is there are some ways that as Jamaican people, especially, we tend to be very prescriptive. We tend to tell people what to do with for them body, right? And people come from different schools of thought about if you should have surgery to remove your breast, and why or why not. People have very strong opinions on if you should do the traditional treatment or, go take some herbs or something like that. Remember that ultimately it's not your decision. No matter how you love and care for this person, it's their decision. And the third thing I would say is sometimes we can be judgmental even when we don't realize it. So especially when somebody is vulnerable in this position, we don't want to be putting on them, boy, somebody that watch how you eat unhealthy and me never say nothing. Like anything that can hint at, boy, this is your fault, right? Or anything like that can just be very unhelpful for somebody who's going through the journey. So watch what we say. And I think the fourth thing I will say, going back to my kind of, emotional coping that I was talking about earlier, the fact that sometimes people just want to force people who are going through treatment to just be happy. And guess what? The happiness is really about them. They're the ones who want to feel less sad. And they're trying to push you to just be like this fake positivity. Just cheer up. Don't feel sad. Have faith. And you have to realize that sometimes a person just needs to mourn because there are significant changes that are happening. And it's a straight up difficult situation to be in.
All right, that's a lot to take in, but a key points to take in and to appreciate that it's not us going through it, and we are there for support. And yes, a whole heap to take in just now. Now, I'm thinking of maybe attitudes. Is there any bias, any difference with a diagnosis between a younger patient and an older person? Is there any difference in maybe the attitude or prognosis?
So prognosis can differ. Generally speaking, and this is without getting into, because I'm not a medical practitioner, so I can't speak definitively to it, but I know that some of the cancers that present in younger people tend to be aggressive, right? So just generally speaking, just like a general reference to that. But in terms of the responses, it can feel even more distressing when cancer hit you like in your 20s or in your 30s, even in your early 40s, because you're not looking for that, right? And then, of course, all the things that come along with it. Because when you're in your 20s and 30s, you feel bossy, you feel cute, right? And then thinking about some of the treatment considerations for breast cancer, like possibly losing your hair, depending on what kind of, what kind of drugs are prescribed for you. Things like having a mastectomy, possibly, to save your life, right? And thinking about dating and, just the figure and all those things can add an additional pressure to a younger woman who's going through breast cancer, or a younger person. Remember, some men get breast cancer as well.
Right. Now, Kamala, from your experience, what would you say is the support looking like from like the government or other members of authority? Are you pleased with that type of support so far?
So I love how seriously people in general, especially in Jamaica, take Breast Cancer Awareness Month. We pink out and we have seminars like these. Excuse me, and we're raising funds, and that's definitely powerful. I feel like one of the things that we need are to focus on increasing greater access, especially for women who don't have the resources to afford treatment. And I'm hearing some good things. I'm hearing about in different hospitals in different regions, Jamaica is trying to get more mammography machines in different parishes, because right now Kingston has the most, right? So people have to travel sometimes a far distance to come for those kinds of resources. So I want to just join you all at Bridge in just imploring anybody who's listening, who's in a position of power and influence, to think about how we can make our contributions to Pinktober most valuable. Sponsoring women to get mammograms because it costs money, or helping to be a part of raising funds for getting the machines in place. And of course, for those who are listening from like insurance companies, just being mindful that, insurance is a key piece of it, but not every woman has it for various reasons. And whatever you can do to be of more practical support would definitely go a long way.
Love that. Love that.
All right. Yeah.
No, I have to, before we even wrap up the interview, Roddy My G, Kamala, I have to say this, I can't make it go without saying this. So, some years ago, I've witnessed, Roddy My G, how Kamala helps patients who struggling and battling cancer. And Kamala, you helped a sister of mine, Josanne Sutherland, years ago. And to this day, I still want to thank you. Of course, Josanne, she transitioned a year ago. It wasn't because of cancer, but I remember, just all the effort that you put in to help her. And I was there documenting the whole process as our little cameraman following her around. And, we just definitely want to thank you. Her family, I know they want to thank you, her friends as well. So just thank you so much for your efforts. You get me?
Well, before we let Kamala go, it is still going, while we're going through that process, we're still living, and we've spoken a lot about the psychological impact, and we've talked about the support groups, but there's a space that we haven't touched, the workplace, your everyday routine. What would be your words of encouragement to those in the workplace and those living with breast cancer?
Yeah, so for some people, going to work gives them a sense of normality, even while they're going through treatment. And let's be clear, not everybody's job allows them significant time off, like to go through the whole thing, right? So I would say for those who are, again, in positions of power, we have to talk to UNOTO. It's important to remember that this takes a significant toll on the person who's going through the treatment. So check in with them. If you can offer them flexi work arrangements so they can be closer to home if they need to be, or leave a little bit early, those considerations can really make a big difference. And of course, when you come into the workplace and everybody know that you're going through breast cancer, going back to my previous suggestions, let us be mindful to be kind, because not every day you want to talk about the fact that you're going through breast cancer. Not every day you want, to be encouraged in a particular way. Sometimes you just want to go and feel normal. You just want to go and have somebody say, is there anything you need today? If so, just let me know. Just leave it open-ended. Whatever you need today, I've got you. I'm here. As opposed to then, Lord, girl, or the chemo go yesterday, Lord, you look a little bit pale. We don't always need that, because it's just a reminder of what it is that we're going through.
Some normalcy needs to be maintained. We appreciate that.
Yeah, man, definitely.
Speaking with none other than
Kamala McWhinney.
Yes.
Psychologist and breast cancer survivor. Kamala, thank you so much. And we appreciate your work and your efforts.
Thank you so much as well. And it's so good to hear about your son.
Yeah, definitely. All right. Give thanks.